Plumas County Public Health Agency, growing healthy communities.
Yeah, it's really kind of humbling to be here. I never really thought of myself of ever being in this position, but oftentimes I introduce myself as a dopeless hopeaholic, and I truly am. You know, I just over the years in the recovery community, I've seen so many people die of the disease, and I remember my first harm reduction meeting was right here in this library. It was hosted by the Sacramento Harm Reduction Alliance, I think it was, and I was just shocked that, oh my God, we can do something. You know, we don't have to just watch somebody take their last breath and say, dang, too bad. You know, and so as being part of the coalition when it started here in Plumas and Sierra County, Lassen County, Modoc County, and Siskiyou, I think we have 5 counties now, but and just seeing this grow and access to naloxone and access to treatment. I remember one of my first clients on the job for Sierra County was a heroin addict, and I just love this guy. I mean, I know what it felt like. I've been there myself, and I knew what he was going through. And he would try and he would fail, and he would try and he'd fail. But over the 8 years, this guy just keeps coming back. And he's actually been one of my best advocates for distribution of naloxone, telling me where the needs are. Hey, you know, this guy, that guy, you know, let's go, I'll introduce you to them. And I think that's a big part of being successful in your community, is knowing the community like they talked about before and what their needs are. You know, I know we have lots of rules in the human resources or in the behavioral health deal. It sometimes is frustrating, the confinement. Another problem we had in the rural counties of Sierra County, which is from Reno all the way to Grass Valley, from Truckee to Highway 70 here. But it's a large, vast area with a total population of 240 or 2,400 people. And transportation to services, access is really difficult. You know, a lot of times they have to be a behavioral health AOD client, and they have to be a mental health client, and they have to have MHSA, I think it is, where all these different, the criteria just to get a ride in a car to a doctor's appointment is horrific, you know, and that's always been a problem. And we've kind of got real creative in finding ways of getting people rides through the AA and NA community. Sometimes beds are hard to come by for a detox, and luckily our Narcotics Anonymous community are really involved, and we've had a couple occasions where they've sat with people in a room that maybe a resort gave us the room for no fee, and people took turns staying with the guy for 3 or 4 days until a bed opened up. And that's really invaluable too, because you can't just tell somebody, gee, sorry, they don't have a bed till next week. You know, come back Monday morning and you may not ever see them again. So I don't know, I guess the slide thing? Yeah. I'm going to show some people. This is Sierra County. This is Sierra Valley, Beckworth Peak. And the next one. These aren't part of the 2,400. They far outnumber the people in the county. This is Sierra City, a small community about midway between Loyalton, where I have an office, and in Downeyville, where I have another office. I'm the only alcohol and drug employee for the county, so I spend 2 days on the west side, 2 days on the east side. This is a local farmer. Went across the restaurant to get something to eat, and you know, I wanted to check his glove box for naloxone because I think everybody should have it in their car. This is on the way to one of our treatment facilities in Grass Valley, just beyond Downeyville. Like I said, year-round, sometimes weather conditions, the snow might be 3 or 4 feet, and it might be impassable. This is a good day. This is one of my Narcown distributors, Jay. He owns a store in Sierraville, and he's a former EMT. And a lot of people go to the store, and this was one of the stores that I went to. And I said, "Hey Jay, would you mind doing this naloxone thing for me, distribution?" And he's going, do I have to do any paperwork? And I said, well, if you don't want it, no. He says, well, how about do I have to? So what I say to mine, I said, no, it's free. You just give it away if somebody asks for it. And he's been doing really good, giving away the naloxone. So that's Jay. All of our fire agencies in Sierra County, because they don't have the money to buy naloxone, each fireman has it in their backpack. They have it in their personal cars. On more than one occasion, I've had people overdose and stop at a local volunteer fireman's house because they knew he had naloxone. And we had one reversal on the west side that was, they just happened to know where the guy, a fire department member lived. They went by there, and so that worked out great. This is our new sheriff-elect, Mike Fisher, very supportive of the naloxone distribution and sympathetic to addiction treatment and the problems that different people have with addiction. I trained all of the deputies in Sierra County. They all have it in their car. Some of them even asked if they could put it in their personal car. So that's working out really well. This is our local pharmacist, EJ. She doesn't like people that look at her. But she's been on board from day one, and she's been hounding me for 2 years to do a needle depository type program, and we finally got that going, and it's all thanks to her. I'd see her at Reno Aces baseball games. She's, Daddy, did you get those boxes yet for the needles? But these pharmacies, I don't know, small communities, they know the population that takes the prescription medication and who abuses it, who's dog ate it, they lost it again, always coming in for it early. She identifies the high-risk people. She takes them in the back room, tells them about naloxone, teaches them and a family member how to use it. And every time she gives one away, she calls me and says, I need another one. I mean, she's just really on board and excited to help out. And she has cough drops if anybody needs them. And this is the lobby in my office in Loyalton. It's no questions asked, they're there. It's funny, I'll come in the morning and I'll look and I'll go, there's only 2. There's only 1. And you know what, it's great. I think everybody should have one of these things. And the people who use drugs, heroin in particular, they know all about this stuff. And inside each packet, they have a little pamphlet on fentanyl, one on Hep C, one on how to use the naloxone, another one on treatment options that are available in Sierra County, and then a schedule of AA and A hotline numbers. So I try to make all that available. And this is Linda at our Family Resource Center, or Wellness Center in Loyalton, and their entire staff has been trained, and they also distribute naloxone. It's another one of those places where people aren't intimidated. It's not a government agency. People go there to play checkers, to take showers, to use the laundry, to do all kinds of things. And it's the same way. It's on the counter. They can take it. They can. It's there. And took this picture at Hot August Nights, and when I saw it, you know what I thought? I thought, I wish more people would get on board the naloxone train, because there's a lot more we can do, and I'm just really excited to be in a position, and like you guys, where we can make a difference. And some of the greatest successes I've had have been after hours. When I go to somebody's house and talk to them about addiction or naloxone or harm reduction, or I know my boss was really surprised the first time I did a treatment plan for a heroin addict, and it said, you know, I'm going to use less. You know, I'll try to use less tomorrow. You know, and but to me, you got to start somewhere. You know, and there's so much more help available now, and access to treatment seems like it's getting better and better, and I'm really encouraged for the future. Thanks.
So thank you all for being here. From Lassen County, like Zach said in the introduction, has been the director for a little over 2 years. And in that 2 years, we've tried to implement several changes, and even though they're slow changes, they're still changes. So any progress forward is positive progress, in my opinion. Can you go to the next slide? So some background on Lassen County. Lassen County is a rural county in Northern California. It's the 8th largest county in California for land mass. But we have a relatively small population. We have roughly about 35,000 people. And if you take out the incarcerated people, which run about 10,000, we have about 25,000 people in our county. We have 2 state correctional facilities and 1 federal facility. Yes, we have a large incarcerated population. And then in our 1 incorporated city, which is the city of Susanville, it roughly has 6,600 for the population. So that means we have about 19,000 that are dispersed across the rest of the county. And so that can be challenging at times. We have 2 fully staffed fire departments, one in the city of Susanville and then one that is tied to our Army depot out in Herlo. So there's multiple volunteer fire departments. The volunteer fire departments kind of go with each of the little pockets of populations that we have. And then our sheriff's officers are often our first responders. They're usually the first ones on scene, even though our sheriff are also limited. We don't have a robust department. I believe we have 19 that alternate 24 hours a day, working 7 days a week.
We have 5.
Well, in that number, they are also custody staff for the jail. So that's not just patrolling. We have 1 25-bed hospital, which is also located in Susanville. Like many rural locations, it'll take, for most of the locations, it's going to take more than an hour for first responders to arrive on scene if there's a call. Just to give some perspective of how far we go. So identification of a problem. So in 2015, the Northern Sierra Opioid Safety Coalition did a lot of research and work and brought stuff to the attention. For Lassen County, there was enough opioids prescribed to keep every man, woman, and child medicated around the clock for 15 weeks each year. That's a lot of prescriptions being written. So in April 2015, a local physician was charged with misprescribing opioids. And in small rural counties, it's huge. Everyone knew about it because people were walked out of his office while he was taken to the back. Like, everyone in the town knew about it the next day. And so that brought a lot of light to our local providers. They realized that their colleague was now in trouble, and he'd been a well-respected community member for well over 20-25 years that he had been practicing by this point. There was an increased awareness of overdose victims presenting to the ER. Our ER was just inundated because, like I said, we only have 1, and most of those people are getting intubated and shipped out to larger facilities. And other prescribers were feeling the push of new clients because now all of our doctors' clients that he had could no longer go to him to receive their prescriptions, and they were pushed to find other providers. Barriers and challenges. Like other counties, we struggle to fund projects. If there's not direct funding tied to a project, it is very hard for us to stay committed to something. Also, the perception of our community members, the stigma, the labeling, that is all something that we struggle with, I think, in small town communities. It's, oh, just send them somewhere else. Send the drug users somewhere else. And I really enjoyed the presentation earlier where they talked about saying people first. That is definitely something I'm going to take back to my board of supervisors when I talk to them. So again, funding is always challenging, the lack of awareness around prescription opioids, and then the stigma and perception of those that we are trying to convince. The start of change. So we joined the Northern Ontario Opioid Safety Coalition when it was in the process of developing. I think it was officially formed in January of 2016, I believe. And so thanks to Plumas County for starting those conversations with us and continuing to push us and just calling and saying, hey, have you done anything with this lately? I appreciate that. In June of 2016, we had a prescribers dinner. All of the local physicians were invited, and a specialist from Nevada came and he talked about alternate treatment plans, what they could do to start tapering their clients off, and to be their colleague to answer their questions of, okay, so we've created this person who's now addicted to opioid prescriptions. How do we undo this? And I believe that person was out of Sierra Pain Clinic in Reno. And it was a great dinner, well received, I feel. And then in 2017, we did not have a behavioral health director, and so I was overseeing their nursing staff because they also had no nurses in behavioral health at that point. So public health nurses were going and filling in at behavioral health to make sure that they could still maintain their clinics. And in an office, I found 204 doses of naloxone, and I'm like, what are you guys doing with that? And everyone's like, I don't know, someone else bought it. And I'm like, are you guys gonna do anything with it? And everyone kind of hem-hoed around about it and was like, I really don't know. I'm like, okay, well, I'm just gonna take it then. And that's when I really started having engaging conversations with Plumas County on what can I do with this? What did you guys do? How did you do it? And how can I steal some of the stuff you've already done? In June of 2017, we had a presentation done by Eliza Wheeler and California Department of Public Health, which was amazing. We had planned for 150 people, got a great venue set up, and I believe we had 20 people show up. But not all of them were staff members, which is what I appreciated. So we had some community members that showed up and had interests in this, and it started some conversations. So even though we didn't get the turnout like Plumas County has gotten here today, it was still well worth it. And it was wonderful to hear Eliza speak and give her perspectives of getting started and other projects that had started. Next slide. Oh, thank you. So for interventions through partnerships, Lassen County started moving towards distribution. I obtained the permission from our health officer to move forward. Our health officer has been the health officer since 1984, I believe. So I needed to have his approval to move forward with this project. And once he said that I could work under the coalition's standing order, that started another ball rolling. We gathered a group of motivated individuals that had seen Eliza speak, and we started trying to figure out what we were going to do next. In September, James came over and did a train the trainer with 10 staff members, and that's when we started working on the distribution plan for the California Department of Public Health grant that they had out to get more naloxone. And then in September of 2017, we actually started the naloxone distribution program primarily out of public health and behavioral health. That's where we started. We are continuing to grow. Again, any progress forward is still progress forward, regardless of how small it is. We're committed to the promotion and protection of the health and wellness through educating, prevention, and collaboration. That's something that I truly value. And we did receive some funding, so we received more we were able to get the naloxone grant from CDPH, which allowed us to buy more naloxone. And then we contracted with Plumas County so that we could fund an FTE, I think it's 2.20, but it's better than where we were. And then we started setting up distribution sites throughout the county. So we have what are called one-stops. And so like in Doyle area, there's a one-stop. It's like a resource center. So you can go there and fill out a Medi-Cal application. You can go there and fill out a CalWorks application. They used to provide behavioral health treatments at that location. Peer partners would go to those locations. It's kind of like a drop-in center, but it's not, there's other resources there. So we've worked with the one in Westwood, there's one in Beaver, then there's the one out in Herlong, and so they are now distributing naloxone for us, and that helps us reach those outlying areas that we can't quite get to. The person who works in the program, she's also gone up and done an outreach in what's called Little Valley. Little Valley is a place where most people would not go. They know there's one way in, well there's two ways in to this particular area in our county, and one of them is a dirt road. They know if you're in a county car, like the person in the first house has already called the person in the last house. They're well aware of anyone who is not from their community arriving. And so Vanessa went up there and she distributed some naloxone. And we actually ended up giving them more kits because they're so far out and we don't know how long it's going to take for EMS to get to them, in hopes that it would save a life if needed. So that was one of our better outreaches, I think, because it's reaching a community that definitely needs it. We are also working with our sheriff's department. They finally emailed me back and said, yes, come teach us about this. And I said, great, when can we see all of your staff? I haven't gotten an email back yet, but it's a step. And then we have gone down by our river and done a little bit of outreach. That one's kind of hit or miss because with our population, they get up early in the morning and they move to the area. Crossroads is a community-based organization we have in our community, and that's where they kind of hang out all day. And Crossroads is faith-based, and there's a little bit of reluctance for us to come in and do education there still at this point, but we're continuing to try to figure a way to come be there. And then something I think is great, we've distributed 150 kits so far through the centers and to our community members. We are told there's been 3 reversals, but no one will give us any detailed information on the reversals, so I can't confirm them, because in a small town, people just don't want to talk about it. They don't want to give you any information because they are afraid that their information is not autonomous, like that it's going to get leaked out, or it's going to get reported to the sheriff's department, regardless of how much we try to tell them that we're just trying to track the information to see how valuable it is. And then this is my last slide about impact. We've had some positive outcomes. We've seen the number of prescriptions drop, the milli equivalents drop, and the overlapping opioids and benzoids. We have seen treatment prescriptions increase, but the thing that is still startling is in 2017 we did have 4 deaths related to overdose, which is an increase for us in the number of deaths. And so we're just trying to figure out what else we need to do to continue moving forward so that we can reduce that number to 0. Yes?
Are you working with the Susanville Indian Rancher Band?
We've invited them to some conversations, but I believe Jacqueline Bay is no longer there, and that was the person that we had talked to. I'm working on Dead Soho though, because I think it would be really important for us to gain a better working relationship with our tribal community. Well, that is it. Thank you.
Plumas County Public Health Agency, growing healthy communities.